First of all, thanks for coming. We didn't schedule this knowing it was competing with the Democratic Convention. So I think we'll probably make it fairly quick tonight because I know everybody wants to go hear one of their favorite speakers speak. So I got here this way. In February, I took a CME trip to go skiing in Austria. And the day after we left to go to Austria, the epidemic broke at my hospital at Evergreen. And I found out it was started in the nursing home where I was the nursing home medical director for 20 years. So it became personal immediately. And I spent 6 days in Austria and then left to go to Switzerland, stay with an old Kirkland friend. And the Austrian epidemic closed down the ski areas 2 days later. Wow. I was one valley away from a hotspot. We were supposed to go to the Italian-speaking part of Switzerland, but our host begged us not to because it was full of COVID already from Milan. And I'm glad we didn't because it had 300 cases by the time we left Switzerland. I was going to leave Switzerland on Sunday night, but on Wednesday night at 2 o'clock in the morning, both my sons got on a teleconference and told me to get out of Switzerland right now because the president was closing the borders. So with my son's frequent flyer miles, we booked a flight out at 10:45 in the morning. I got 1 more hour's sleep and we boogied out of there, only to come home to find half my schedule canceled because no more primary care visits, no more wellness visits, and all the respiratory illnesses were shoveled off to urgent care. So we weren't seeing anybody with a cold anymore. And it was a weird time and back there in mid-March. And I decided I needed to bone up on what the hell was going on since I'd been out of town and figure this virus out and start doing some research. And so I posted an update on Facebook. And then I did it the next day and did it the next day. And half an hour ago, I posted today's. I've been trying to get the facts out for the whole time and stay up on what's going on with the science. And much to my surprise, a lot of people were very complimentary and told me they'd come to rely on that as a relatively objective scientific statement, a little more educated than most journalists and a little less biased than most politics. So, and then a couple of friends have weeded the politics out over and over because it keeps seeping back in. But that's how I got here. So along the way, Louise suggested that I do something about the racial disparities. And when I started with this about a month ago, I could only find 4 articles on COVID and racial disparities. Since then, that subject has kind of exploded in the medical literature, and there's a lot now. I couldn't even begin to catch up, but let me show you what I've got on a PowerPoint, assuming I'm now the host, which yes, I are, so I can do this.
Oh, and thank you, by the way, for all those Facebook posts.
Well, you're welcome. Here comes the PowerPoint. So, racial disparities in COVID-19 in the US. This is early research. The risk factors that are associated with adverse outcomes are old age, male gender, hypertension, diabetes, obesity, other cardiovascular risk factors. That's where science, the medical scientists start there because they don't think about race and ethnicity right off the bat. They start thinking about all of this stuff. But those risk factors cluster with African American race, and everybody noticed that immediately because guess who was coming in the hospital? So there were several early studies that were out in March and April. In Chicago, African Americans made up 30% of the population, but 50% of the cases and 70% of the deaths, concentrated in 5 South Side Chicago neighborhoods. Now, that should get your attention if you're in medicine because we already know that the #1 predictor of health in America is the census tract you live in. That doesn't sound reasonable on the face of it because it's not biological at all. And one would expect that your health would have something to do with your biology, but it has much more to do with where you live. And that's kind of shocking and hasn't really been analyzed very well. The next study was in Louisiana, where African Americans are 32% of the population, but 70% of the deaths. You can see there on the slides, and you're all welcome to get the PowerPoint if you want. I gave it to staff, and I can send it to anybody by email if you don't want to get it directly from the church. Michigan was African Americans at the 14% of the population, 33% of the cases, 40% of the deaths. New York City, 22% of the population, 28% of the deaths. Hispanics are 29% of the population and 34% of the deaths. So Hispanics also now show up as a risk. Then Hopkins, which has kept the best database for the nation, analyzed 131 predominantly African American counties. That's all there are. These are places where more than 50% of the population is Black. And the case rate there is 3 times higher than whites, and the death rate 6 times higher than whites. That should get your attention. So this is what happened early in medicine, is discovering in March and April, this is really, really bad racial disparity going on, ethnic disparity, worse than people expected. This is an Ochsner study in Louisiana. That's the big private clinic system, sort of like the Mayo of New Orleans. And Ochsner studied their patients to find out if they were being racist. And what they really did was analyze what kind of people got hospitalized and how did they do once they were. And that's what they wanted to know, is really, are we racist? And what they were able to demonstrate was that Black people were dying at huge rates, but once they got in the hospital, they did just as well as the whites. So they could wash their hands of being racist in their treatment, but there's something clearly wrong with who's getting sick. This is the recent King County data. It's now a little more than a week old. 752 cases per 100,000 residents is what we've had so far. Among the Native Pacific Islanders, the rate's almost 3 times that. Nobody in the rest of the country has noticed that Hawaiians and Pacific Islanders have very high rates. But have you seen any Samoans lately? They're huge people. And overweight, even if you're strong, puts a restriction on your lungs, and it makes it hard to breathe when you've got an infection in your lungs with a virus. So it's a big risk factor for death and destruction just to be very overweight. Hispanics aren't as bad, but they're still terrible compared to the average. Blacks are worse than average. American Indians were less than average, and Alaskan Natives, which was a big surprise, but the numbers are kind of small. And Asians were less than average, but about the same as whites, which are both way less than average, about half the average rate for our county. So the disparity is right here local. It's right here in our face. This is the bar graph. Shows basically the same data, not quite the same date, but it's the same idea. I'm going to skip to the next slide. These are the hospitalization data. Now, when you get admitted to the hospital, that's still a tiny fraction of the cases, right? So we count confirmed cases only, and there are somewhere between 6 and 24 times that many cases out there that haven't been confirmed because they have no symptoms, have minor symptoms, don't get tested, got tested too early, got tested too late. All of those things, we're missing the vast, vast majority of the cases. But of the confirmed cases in our county, 12% of them wound up hospitalized. Simply note that the death rate among Hispanics here is just about 3 times what it is for white people. And the other categories didn't get reported by the county because they didn't reach statistical significance. That's because death is not just the worst outcome. It's only about 0.6% of the cases. So here's the effects of social determinants of health. Now, social determinants of health is now a buzzword in medicine. It's used in the literature all the time to point out that the usual determinants of health that we mentioned at the beginning aren't the whole story. In fact, we all know now that social determinants are much more important than biological ones, and yet they're hard to explain. So if Census Tract is the most powerful predictor, then what does that correlate with? And it correlates with wealth, income, educational attainment, employment status, unemployment status, school quality and achievement, crime, access to high quality fresh food, socioeconomic status. What about redlining? Why are these poor people all in this same area? You know, that's how we've architected our culture. And now what you're seeing is people are dying because they're poor and they live in bad neighborhoods. And if that's not systemic injustice, I don't know how you can otherwise call it. So medicine, the House of Medicine, is now looking at research literature that's pointing all this stuff out. And it is really just an enormous flashlight shining on stuff that people have tried not to talk about for an awful long time. So people then became aware that what we can do for this epidemic is hand washing, social distancing, and then there was big controversy in medicine about masking at the beginning. And there still is some, because there's not really good scientific evidence that masks work. What there is stunningly horrible data, let me put it this way, stunningly obvious data cross culture that shows that cultures that mask up have much, much better results. And that kind of research means that American doctors have to compare themselves to doctors in other countries. We don't like to do that because American docs think they're better than everybody else. They don't even like to look at research literature from England, for God's sake, or Italy, let alone from China. And everything is suspect if it wasn't done here. Well, I'm telling you, those days are about over inside of medicine because of this phenomenon that's going on. By the way, I need to give credit to Elaine Palmer-Cox for giving me the slides with the graphics, as I didn't have those. She was going to be co-hosting with me, but she had a Boy Scout event last Sunday. Anyway, these are hers. This is the census tract in graphic form. The density on the left is the COVID rate. The density on the right is the equity score, where the darker it is, the worse it is. So do they correlate or what? It's just, it's blatant right in front of your face. Now, there's more data. By May, Chicago had Hispanics at 1,000 per 100,000, blacks at 925, others at 865, whites down at 389. Deaths were already African Americans way high, Hispanics 50% higher than whites just in Chicago. And when New York went through its hell, Hispanics had higher rates of death from COVID than blacks, and they were both double what the whites had to go through. So again, this is pointing out to medicine, the House of Medicine, what's going on. And again, I'm pulling out the research literature. The next thing I found was 47% of renters live in unaffordable housing, defined as requiring more than 30% of income in rent and utilities. In other words, if you have to spend more than 30% of your money on those things, you can't afford to live there. But that's where 47% of renters live. I was kind of stunned by that. That's not stuff that you see in the medical literature, but that's where I found it. So again, the social determinants of health have now hit the medical literature. There are almost 23 million Americans at risk of eviction because they don't have income anymore because they're unemployed to pay for their housing, and they're at risk of being homeless. Now, that kind of stuff does hit medicine because who do you suppose gets sick then and fills up your hospital beds? Folks who've lost their job and lost their insurance and aren't going to pay your hospital? No bueno. Okay, so the explanations in medicine for disparities. Risk factors cluster within these groups of risk factors like obesity, bad lungs, heart disease, diabetes. They cluster with geography, with the census tracts. Social distancing turns out to be a privilege. People who have computers aren't everybody. People who can work from home aren't everybody. People who have to live from hand to mouth is most Americans, and being out of work is a disaster. Folks who don't who have to work, don't have childcare at home, can't afford it. All of those things are playing into who gets sick. So no one in this has really spent any time this year looking at the biological and genetic differences. That's what they used to do. Let's figure out what's wrong with those African Americans and Hispanics. They must be biologically inferior somehow. That's not what's going on anymore. What is going on is people are calling out that, you know, these are the things that happen from systemic racism, redlining, lack of access to banks, lack of access to decent groceries, lack of access to healthcare, lack of access to insurance, rotten, horrible insurance that is supposed to give you access but doesn't. All of this stuff is now being talked about openly, especially since we now have a generation of young doctors who are no longer white men. And they're no longer white women either. They're all kind of folks have come out of medical school, and some of them are quitting their academic posts because of their institution's refusal to deal. So that's the stuff from the House of Medicine. It's very clear to me that for the first time, people are talking in a very different way. And you know, we're all mature adults here in this group, but if you're a young person, I don't think you realize that we haven't had a conversation like this ever, like we're having with Black Lives Matter across the country and about police brutality, and now inside the House of Medicine talking about systemic racism. I'm telling you, this has never, ever, ever happened before. So that's the positive side of this. There's an awful lot of negative. There's an awful lot of negative. But the positive side is, like the Chinese curse says, change and opportunity, right? So it's now 7:20, and you see, we've arrived here. There. Now, everybody want to go listen to Barack Obama, Hillary Clinton,